Uniting against Ebola, business leaders in Sierra Leone's capital, Freetown, are on a campaign to spread the word.
We need to join the government together to make sure we fight against Ebola, because Ebola is a killer disease that has no remedy.
A killer that's now taken more than 700 lives in Sierra Leone, Liberia and Guinea this year. The heads of those West African nations have agreed to create an isolation zone at the heart of the outbreak. They've been meeting the World Health Organization chief, who made this appeal to the international community.
You must support the extraordinary measures by providing experts, laboratory capacity, protective clothing, and other resources, including financial resources.
This is the largest outbreak since Ebola was identified in 1976, and some medical staff treating victims have themselves become infected. 2 sickened American aid workers in Liberia are being flown to Atlanta for treatment, the first time an infected victim is entering the United States.
They have become infected through medical care, and we feel that we have the environment and expertise to safely care for these patients and offer them the maximum opportunity for recovery from these infections.
Ebola is highly contagious and spreads through direct contact, yet outbreaks have largely been restricted to Africa.
It's really only a threat to countries that have sort of weak health systems, that might not have the sort of infection control practices and materials and the sort of disease surveillance systems that can lock an outbreak down.
Ebola is one of the most life-threatening diseases to humans. It attacks almost every cell in the body. There is currently no cure or vaccine, a problem some blame on the lack of financial incentive for pharmaceutical companies to develop, and one that they say needs to be addressed. Gerald Tan, Al Jazeera.